Hi, I'm Dr. Amna, and today I'm going to make my first introductory video. I'm super excited for making this video because this is an absolutely a new field for me. I never tried it before. Because before that, I was in an impression that there are million and million videos out there with million and million topics. So, what's the point of adding more video? But later I realized that every human being is unique. Every human being has their own capacities, skills, talents. And fortunately, we are living in an unprecedented era of social media. So all people have an equal playing fields. So it's an equal opportunities for everyone to show their skills, show their experiences, talents. And regardless of the reason, it's okay to make videos to engage your clients for your business. Now I'm going to introduce myself uh, and what kind of content I'm going to present in my following videos. I earned my medical degree from Fatma Jinnah Medical University, Lahore, Pakistan, and later I did my training in pediatrics from Sir Gangaram Hospital, and then in gynecology and obstetrics from the Fatma Memorial Hospital, Lahore. I practiced family medicine a few years before moving to Canada. In Canada, I passed my LMCC, that's the Licentiate for the Medical Council of Canada examinations. And also, I did my uh, diabetes educator graduate certificate from the Michener Institute of Health Sciences from Toronto. I started off my career in Canada in inner city health promotion projects as a volunteer. So, by volunteering, I got excellent opportunities to build connections. One of my top connection was the Community Matters. Community Matters is a local non-for-profit organization which gives support to all the professionals who are immigrants. With their help, I got a role in inner city health promotion project. Another project which I did with the collaboration of Community Matters was the launching of the diabetes prevention program in St. James Town. The St. James Town is a community which is the most densely populated area in the North America, and there the people are speaking 100 languages. And from there, my career just took off. From very beginning, I have a passion of clinical research. So after working 2 years in Health Access St. Jamestown project, I started volunteering in Women's College Hospital as a clinical researcher. After a few months of volunteering, I got hired as a clinical researcher in again a diabetes project, and there I worked for 5 years. So this is the introduction regarding myself, my credentials, and my experiences. Now I am going to give some insight about what I'm going to present in my content in my following videos. I'm going to present in two languages, in English and in Urdu. The reason is that many people have language barrier. They want to learn, but they have language barriers. So if a person uh, know Hindi or Punjabi, they can easily understand Urdu because they are kind of similar languages. Another thing which I'm going to do is that I will keep my sessions short because 5 to 50 minutes of sessions enable short, hyper-focused bursts of learning. Next, I will talk about that how dire the situation of diabetes is. It is the most rapidly spreading disease, and it is like an epidemic. And according to the International Diabetes Federation, at this 10th edition 2021, they provide the latest figures, information, and projections on diabetes worldwide. So in 2021, approximately 537 million adults, from 20 to 79 years are living with diabetes. Three in four adults with diabetes live in low and middle income countries, and almost one in two, like 240 million adults living with diabetes. So, my goal is to outreach diabetic patients as well as the at risk patients. Not every diabetic has all the symptoms, and I know that many patients come to the doctor when they already develop the complication, because when they are experiencing blurred vision, then they visit their doctor and say, "Doctor, I cannot see well." Then when the doctor checked the blood test, so they were diabetic. So it's already being so late. So there's already onset of the complication. So if a person has a knowledge of that what the diabetes, and it's not necessary that everyone has all the symptoms as I mentioned before, but it is always good to know that what are the symptoms are. Those symptoms are like increased appetite, increased thirst, increased urination, and also the person feel tired all the time. um, One of the major factor for uncontrolled diabetes, according to my research, is that, and what I observed is that the non-compliance. And the non-compliance is not necessarily the patient's fault, because there are so many difficulties in acquiring medication. For example, they cannot afford it, or they have not accessibility of the medication. And also the other factor is that the poverty and diabetes go hand in hand. I'm not saying that this diabetes is the disease of the poor people. Like, people from all social statuses have diabetes, but the poverty is one of the most important reason that why people are not compliant about that. When I was doing my diabetes educator graduate certificate from the Mission Institute, Toronto, one of my course mates, nurse, asked me a question. She said that, "Doctor, why are you doing this course?" She was surprised because in Canada, um, once the patient is diagnosed with diabetes, they are referred to the diabetes education centers, where the dietitians and diabetes educators train them how to control their diabetes, because it is so vital to understand that, unlike in our countries where the only is the medication, only there is, maybe there are some hospitals which are giving the education, diabetes education, but in the mainstream the concept is just to have medication and then expect that your diabetes got controlled. But this is not the case. So in Canada, when they refer, they are trained in self management, that how to manage their diabetes by themselves, by the lifestyle modifications, by healthy eating and physical activity. And by acquiring that knowledge, the patient is able to take control of their health. So basically, my point here is that my mission is to spread awareness. So as I said before, that people are not are non-compliant, whatever the reason is. Okay, so they are not getting their medication, but this is a disease that if person know how to eat well, how to control their portions, how to do the physical activity. It's not like the 1 hour per day. It's These are very small steps, and this is the self management is that, and this is the education is all about, to empower the patient that you can do it. And finally, I will talk about what kind of content I'm going to present. Um, First of all, I'm so interested to teach people, to educate people And it's not about the only the diabetic people, it's the all people. This education is not beneficial for for the prevention of diabetes only, but also these strategies which I'm going to present, like the lifestyle modification and the self management, they can help the people to protect themselves from from heart disease, from cancer, and all the other chronic diseases. Because by maintaining healthy weight and having a knowledge that how to eat well, and what's the contribution of fruits and vegetables, and behind every, like, it's not like just do this and do this. We cannot just do things just if someone is doctor is saying, okay, so you don't eat this that and do that. No, this is not the way. The main thing is that people need to learn. If a person know that what is the reason behind this advice, it is 100% guaranteed that the patient will follow the advice. So I cannot say at this point that which direction my videos will go, but from the beginning I will start with the basic understanding of diabetes. What is this, all the myths and the facts about the diabetes, and then all the steps towards the self management. And thank you very much, and I hope you will follow me.